very strong interest in cosmetic surgery. And during this time, 30 years ago, I actually was working with the precursor of Botox in the form of collagen. I worked under the direction of Dr. John Connolly, who became the president of the American Academy of Facial Plastic and Reconstructive Surgery. Working under him for 3 years gave me great insight into cosmetic surgery. And I've taken the principles that I've learned over 30 years and honed them into the best style for me, utilizing not only the invasive techniques of yesteryear, but with my wife we practice many of the non-invasive techniques that are so popular today. Otolaryngology encompasses a wide range of services, and I have a very strong interest in cosmetic surgery from that, and that I've learned a lot in optimal patient care, optimal treatment, and optimal surgical and non-surgical techniques over these 30 years. I am very fired up to be the best that I can be and to make patients the most beautiful that they can be.
Adelglass has been an incredible influence on me as well, as you know, Richard. I mean, it's been a wonderful experience. I've had an advantage beyond being an esthetician. I've been taken to a lot of the aesthetic meetings as well as plastic surgery meetings, and Dr. Adelglass has constantly had a passion for keeping his education updated, which means mine as well has been updated, which is very nice. So I have a great advantage over a lot of people. I get to travel and see all sorts and hear all sorts of different venues. Part of my training was to have a formal education as an esthetician. We do have to learn some anatomy, but of course that's invaluable. On top of that, experience, as Dr. Adelglass said, just here at the office for quite a few years now, has taught us so many lessons that a book can't always teach. And it's been really good as far as just life learnings, and every technique is evolving, it's getting better, and our equipment and our machines that we used 12, 15 years ago have gotten even better and more effective. And we were in the learning curve to start. Dr. Adelglass does a lot of research, so we've had an advantage that we were in on ground A to really see some of these technologies from inception, and here at the office we've been able to follow them to, fruition.
Back when we started, we've been married 33 years, my wife would always critique me on tying knots. I would tie knots on our bedposts to practice, and she would always come around and say, it's not tight enough, or move it down. And she was a constant advisor from the very beginning. And this is how I learned my techniques. My wife is also a very accomplished artist, and when I can conceptualize things, she can draw them to show me and help me to conceptualize what we need to do for individual patients. Together, I think we work as a great team to accomplish what we try to do, and that is making people more beautiful. To me, there is no greater thrill than having someone come in and within half hour to 45 minutes walk out of the office looking more beautiful, getting that wow when they look at themselves and say, wow.
We love what we're doing. It's a passion for both of us. We've learned so much about the industry, but we've also learned it's about the quality. It's the day-to-day quality. Give people the best, give them more than they expect, and they will come back. beyond these fabulous techniques that Dr. Adelglass does, that he's perfected, it's the day-to-day detail, it's the perfection, it's the joy, but it's also all in the details. Give people what they want, but make it even better.
So we truly believe in what we're doing, and we truly believe what we can do for you.